People with depression have difficulty with work, home, and social activities because of their depression symptoms. The Director of Behavioral Health at Pomona Valley Hospital Medical Center, Dr. Dan Blocker, discusses the symptoms and how treatment can help.
Depression, that for a period at least of 2 weeks, more often than not, someone is feeling pretty hopeless, depressed. They've lost pleasure in doing the things they normally like to do. There's been some impact on sleep, some impact on diet. They're not moving as fast as they used to, or sometimes they're moving faster. At times there can be suicidal ideation, lost that sense of purpose and meaning. There is definitely a family component, a genetic component to depression. And I think one thing that's important to differentiate between reactive depression and clinical depression. When something sad happens, it is a normal reaction to be sad. And sometimes people just don't want to feel that, and that's something completely different. Clinical depression sometimes does not have a cause. Sometimes it's just there, like a cloud and a mist that you're kind of stuck in. It can be wiring, it can be family, and it can also be the family environment. Things like abuse, neglect, substance use in the home, violence in the home. The big thing that makes this important is when depression keeps you from living the life you want to live, when it impacts you. When men, it usually manifests as anger, and for women, it usually manifests in just struggling and just not being able to be as productive.
Treatments are based on the severity of the depression.
Treatment is usually some form of therapy and medication, usually for moderate to severe. When you screen someone for depression, you look to see the severity, and then you talk with the patient, you get a sense. If this is a pretty severe depression, let's say that the symptoms are pretty much present all the time and have been so for quite a while, then medication is essential. Medication is going to help get them to a place where the therapy can be effective. If it's mild to moderate, then you can use medication or therapy. They're both equally as effective. The goal of therapy, the reason it's helpful, is it teaches patients the skills that when they decide, and the doctor decide that it's time to come off the medication, that they'll be able to keep their momentum going and be able to continue to manage their lives and their symptoms.
Dr. Blocker reveals that treatments for depression are often successful.
Treatment can be very successful. Many patients, when they learn the skills or when they're on the medication, their lives are manageable. And that's really the goal. The goal isn't that people don't feel anything. The goal is that people feel like themselves and are able to function. It can be very satisfying to help patients and to see the changes they make. I see myself in my role as a therapist as more of a guide, and being able to help be there with them on their journey and be able to see them get to where they want to be is one of the most rewarding things. And to see them come in with their wives or with their husbands or their partners, and they're saying, he's back or she's back to the way they used to be. We're doing well. My kids have noticed a difference. My kids don't think I'm angry all the time. I'm not crying all the time. I can sleep.